So good afternoon everybody. I am Dr. Mohit Bhandari. I am a bariatric, metabolic and a robotic surgeon and also a bariatric endoscopist. With me is Professor Galvao Neto, who is the Director of Bariatric Endoscopy Services at our center here at Indore in India, at Mohak Bariatrics and Robotic Surgery Center. It's an honor to have Professor Manuel join us to spearhead this department which we are trying to bring it up, and because of his efforts we are starting a lot of new things and bringing new avenues to this entire project. Ladies and gentlemen, today I am so excited to talk about a very novel, a very unique product or a device in the weight loss industry. And that particular device is something which has made things so simple and so idiot proof that it inspires not only confidence but also a lot of safety and would lead patients towards it. Yes, I am talking about a swallow pill or a gastric pill or a swallow balloon. I will be using these three terms as synonyms while I am going through this entire length of video. So this is what we are going to talk about today. A vegan capsule which contains a small balloon inside it, and this weight loss device is so simple that this vegan capsule can be swallowed by the patient in an outpatient clinic. Once it reaches inside the stomach, and we are very sure that the vegan capsule is inside stomach, by radiological imaging, we can then fill this capsule with this very thin catheter by a proprietary fluid of 550 ml, which then gets converted inside the stomach in the form of this very soft balloon of capacity of 550 ml. So in the entire process, the patient is just swallowing this vegan capsule attached to a very thin catheter, and it's very soft. It's very soft. It's soft like your capsule which you take, a B complex capsule or any capsule which you take. And there is no anesthesia required, no endoscopy required, no surgery required, and probably this balloon in the world is the only procedureless balloon available. Now, since I have with me Professor Galvao Neto from US and Brazil, and Manuel has a huge experience. In fact, I would not be going or crossing my limits if I would say that he was the one behind this technology of intragastric balloon to bring it to the entire world. With more than 5,000 balloons put, he comes with the largest series of balloons put across the world. Now, let me ask this to Professor Manuel. Do you really feel that such a simple 15 minutes procedureless balloon, how it is going to be a paradigm shift in the way you used to put balloons by doing endoscopies in your time, and you're using it now in Brazil and US? Please.
So Mohit, first, thank you very much. Thank you for having me. It's good to have this conversation in a very natural way. And you know what, we are doing balloons for the last 20 years.
Wow.
Seems something balloon is recently, but it's not. So, and it always offer an option that is more than the available clinical treatment at that time, and less than surgery. So it's an option for the patient for lose weight, patients that not qualify to surgery or don't want to pursue the surgery. So in terms of balloons itself, it doesn't matter what you think, it is a paradigm shift by definition, because before we have to do an endoscopy and implant the balloon and leave the balloon there. And when time comes, 4 months, 6 months, 1 year, that the balloon it fulfill its task, it have to be removed. It cannot stay there. And the way to be removed is that you do another endoscopy, and generally we puncture that, we aspirate all of the liquid or the air or the gas that we have there, and then we take it by the mouth. They are very safe procedures. They are done since the beginning. So the intergastric balloon is a very safe procedure. But what this new technology offers, and you already show, is that this capsule, and you see this catheter here, it will be inflated once it gets up to the stomach. So it's going to get up here, and the only thing that out of the patient is this. That this will be attached to a pump that will put fluid here. I think we're going to show them, and it will disrupt the capsule. And then at the end, when we finish that, we just pull that, detach it, and it floats free. So the balloons, what they do, they occupy space in the stomach. So imagine that stomach is like X. So it will have half of the capability. So the food will not come here, and the patient feels full, and they stop eating. So that's what all the balloons is the same. These balloons. So basically, these balloons doesn't add anything new in terms of what is a balloon, but what it adds is that there's no need to do an endoscopy, no need for sedation. And once the patient swallows the pill, we take a very brief X-ray to see if the catheter is there, and then the patient remove the catheters for sure, and they can go home. And they don't need to come back for a procedure for endoscopy to take it out.
Wow. So yeah.
Yes. So that is the evolution of the whole system. And on the beginning, I have to confess to you, I was like saying, so this gonna take my job out as an endoscopist? So 20 years working on that field. So, and how can we do a balloon without seeing the stomach before?
Yeah.
But then, after the first wave, the shocking wave passed that you see this, then you slowly understand how you do it, because this is natural. You swallow. So you swallow, then you empty there. And there's no need for endoscopy, because the patient feels sickness or everything, he already gonna have an endoscopy before. So by now, I'm much more confident, and I'm much more like seeing this is a really evolution on that. And I have to state that I don't think that the other balloons are gone. They will stay, and this is, instead of taking the market of balloons, it will add more, because more people are gonna be treated as you are, as so many people are, for this swallowable balloon.
Wow, wow. So as we heard what Manuel spoke about the swallow balloons, we don't need an endoscopy here. We don't need any general anesthesia. You don't need to be admitted to the hospital. You don't even need to come to the operating room. This is phenomenal.
This is a room like this.
This is a room like this where you can have this balloon done, and in 15 minutes you can go back home, and all these things. So as Professor Manuel very clearly explained, you need to swallow the capsule.
Take an X-ray.
So you will be the one who will be doing it. Take an X-ray, and the X-ray can be inside this room. We see in a C-arm or any image intensifying device. We confirm the position of this particular capsule inside the stomach, and then we fill it through the proprietary fluid. And what you get is this thing there. So this is very soft. If somebody can feel it, Manuel can tell you this is very soft. Unlike most of the balloons, they are a little hard, they cause ulcers, and there have been previous incidences. This is pretty soft. I like the material, I like the feel, and since I have had the opportunity of installing a couple of them, including Manuel, who had a large series, we really feel that it's the way forward towards the balloon. Manuel, a very important question which a lot of our viewers would want to know. In India and specifically in Asia, the balloons were sort of seen that for the first 48 hours, you have a lot of discomfort. So the balloon market in India sort of didn't pick up because of that, because they thought that there is a lot of discomfort and this is a foreign body or something like that. Now with such a beautiful swallow capsule where you don't have an endoscopy, you avoid the risk of general anesthesia, you don't even need to come to the operating room or the GI suite, what we call. Do you really feel that this particular balloon has less side effects, or maybe it's more tolerable in comparison to the other intragastric balloons which are put by endoscopy? This is my first question to you, because most surgeons and physicians have still that old concept of balloons where they had a lot of GI intolerance. That might be because of lack of protocols to treat it or lack of knowledge, whatever. You can throw more light on it. And my second question to you, which you can answer subsequently, is there a difference between the results of this balloon? Because overall across the world, I know that these balloons, they cause 18% of total weight loss. 15 to 20% is what's been reported. So is it different for this balloon? So these are my two questions.
That's a very, very good and important questions. And first we have to see that this is a liquid-filled balloon.
Yeah.
So once in the stomach, we have the results of a liquid-filled balloon. What this balloon has different? So it's called ellipse for the shape. So it's not rounded like a ball or the other balloons.
It's ellipse. It's elliptical shaped balloon.
Yeah. So it achieves better. So the material is different. It's so different because all of other balloons, they are made of silicone. Mm-hmm. And this is a soft like film that after it empty, and it's very interesting to see. So the liquid that's inside, there's a proprietary liquid. We really don't know what it is inside, but the company says it may be a citrine liquid, but very interesting. You see that balloon so delicate that if you can zoom it here, this is the valve.
Yeah, the exit valve.
At my finger, if you can zoom here. Okay? And what is the magic of this balloon? So this solution here, and you have inside this part here, this is the demos, for sure we don't have it, a very small like suture or locking mechanism. It will be like, I can say that's not the right word, but like corroded. Mm-hmm. And after 4 months, it will open this and it empty and you pass to the bowel movements on that. And again, you should expect the same results of a liquid-filled balloon. And the question is, it's just stay for 4 months.
Yeah.
And the other balloons are 6 months and 1 year. But we have to understand that the weight loss of balloons, they happen on the first 3 months. Then they get plateau. Yeah. And for sure, if the balloon stays for more time, it will keep the weight loss. But it can be replaced for the better understanding of how people lose weight and keep the weight. So what it needs is a program, is what you have here in Indoor in India at Mohak Center. We have a program to understand, to coach the patients for they take advantage of this tool and keep the weight they lose. This is more important than even the balloon who stays in place or not. Regarding your question of
GI
symptoms,
intolerance, yeah.
GI intolerance. Yeah. So the two things. So the ellipsoid shape will possibly lead to less symptoms, and we have to understand that when you get sedation, when you get general anesthesia, no matter how good is the anesthesiologist, there is some drugs that are applied that lead to nausea.
Yeah.
So on the top of the intolerance of the balloon itself. So I can quote that these balloons, we have the same level of intolerance, but taking out all the intolerant parts of the initial anesthesia, and more than that, the perception of the patient that they're gonna go through a procedure to put that inside that is non-existent. So for the overall feeling of the patients, yes, they feel more. And the other thing is that you quoted rightly. On the past, there was such an intolerance because we lack knowledge how to lead with that. So now with this balloon, it comes in handy with the new drugs for nausea and vomit. And for those drugs, they come from the chemotherapy that they develop so much that patients with chemotherapy don't feel that nausea, and they are so much powerful to contain the symptoms than the ones we have used before. So that's all come together that leads that some studies, like a meta-analysis that you saw, that the patient tends to have less symptoms because the management what we can apply to this balloon.
Wow. Wow.
So I pass the bar for you.
Yeah, beautiful. Your answer was very, very crisp, and as you rightly mentioned here, there's a exit valve here, which everybody can see. And so this balloon, the life of the balloon is 4 months, and the beauty or the concept of the balloon, or why it has sort of become a disruptive innovation, is the flap valve, the exit valve here, and it has a filament which has life of 4 to 6 months. So anywhere between 4 to 6 months, the filament is gonna just break through, releasing the exit valve, and all the distilled water in it releases inside the stomach, and this balloon becomes a form of very small capsule which passes through the GI tract in your fecal matter. So the beauty here is that not only you require an endoscopy to put this balloon, unlike all other balloons which are existing in the market, you do not require an endoscopy to remove it. So this is a completely procedureless balloon, if I can say that. The only one I know about. And plus, as Manuel correctly said, that it's elliptical in shape, and we avoid the complications of general anesthesia and the drug complications of general anesthesia. We also avoid all that discomfort which comes to the patient after the routine balloons which are placed. So fantastic! This is beautiful,
yeah.
And I think just because we are making this video, this idea of coming up with such a kind of balloon, because I know the history, and both of us are connected to Allurion Technologies and should give them the credit for this ellipse balloon. The concept came from a professor of Harvard, Professor Ram Chuttani, and his student Shantanu Gaur. And Shantanu was the one who came up with this idea, because Professor Chuttani told me that he came up with this idea, and then we developed it to this level. And they themselves believe that the beauty of the entire concept is the flap valve, where the filament's life is 4 to 6 months. So that releases, and that makes this balloon so unique that you do not even need an endoscopy to pull it out.
Yeah, and also that and you can pass the bar for me. We passed the question on the bar. It just happened, and I would just remember that in the times of pandemic and in the air transmitted disease, this balloon had a major impact in some centers. Like, for example, in Chile, in South America, so there was a ban on the procedures, and that ban on the procedures, I mean bariatric surgery. They couldn't do any bariatric surgery.
Code black.
Yeah, code black and lockdown, and this was the only procedure approved. Why? Because the risk of transmitting, but like an endoscopy, a patient cough and have gag symptoms, gag reflex, they can aerolize, and so if they are contaminated or they have the virus, they can. So it was considered safe to be implanted even on during the pandemic. So again, one more thing, not due to the balloon, but due to the times that we are living in.
Yeah. So very, very valid point made by Professor Galvao is that endoscopy is a very high aerosol inducing procedure, and when we are at times of COVID, where in different parts of the world we see that the COVID crisis come, and there are a first wave, second wave, a third and a fourth, and you never know what happens. This balloon, and the example is from Chile, where this was the only approved procedure during the pandemic times, and all of us know in India that most of us during the pandemic times have gained so much of weight because we are restricted in our homes. There is no physical activity, and we cannot undergo bariatric surgery. And obviously surgery is something, even endoscopy, anything related to general anesthesia exposes the healthcare workers and the patient both to risk of viral contamination. At these times, this sort of a balloon, which is truly procedureless, I think it's phenomenal. I think hats off to the one who produced them, and God bless them. So finally, I come to the last phase of my entire interview with you. There's one a very, very important thing I wanted to highlight to all our viewers who wanted to know about the swallow balloon, is that we are not here, or Professor Galvao or Dr. Bhandari are not here to sell you a device or to sell you a procedure, but we are here to make you a part of our program. So what is our program? So we are not only putting this balloon inside you or asking you to swallow a capsule, but we will be tracking all your progress, including your weight loss, your body composition analysis, your fat loss, the build-up of your muscle mass, your body water content, the amount of sleep you are having, the amount of calories you consume, and the kind of food you eat. Through this simple watch, which is a smart watch, it is simple yet a smart watch, which will document everything.
And it comes with the device.
It comes free with the device. It's complimentary. We don't charge for this. It comes with the device. It calculates your number of steps.
Yes.
It tells you what calories you have taken. It syncs with almost all the apps like Strava or Garmin or whatever you talk
And
about.
also it syncs with this scale.
Yeah, this
is
is
an intelligent connected scale, as you can see here. And every time you go there and just get your weight, but not just the weight. You can see the sensor here. It's a body composition.
So what are these sensors? I think these are the body composition
Yes,
sensors.
they are body composition sensors with your feet here, so they can understand by impedance what is the lean weight and the net weight, and so many information that go directly to your smartwatch and to your phone. And at the time we have the app, so the company has the app, and we as patients can take control, if I can say, of much more variables for their progress on that. And we are on the times of the wearables.
Absolutely.
And they are so progressing, so they can measure your heart function, not heart rate.
Not heart rate, your heart function.
So the amount of oxygen that you breathe and how it goes, and that.
The
and
VO2 max.
Yes,
the
VO2 max,
yeah.
and everything is connected. So we are living in the time of wearables, and this, I think, the very first device that take advantage of this. So it all complements a good team, a good follow-up, and understanding obesity, understanding the patient, supporting the patient. That's very important. The persons with obese that need the multidisciplinary team, that we alone will do nothing. The device alone will do nothing, but the system. And as it progresses, the technology again comes in hand to make the results better.
Wow. So basically what Professor Galvao says is that when you have this balloon, you not only get this balloon, but we track your weight loss by this free complimentary weighing machine which he has shown. We give you a health tracker which will track your activities. We, virtually monitor everything, and everything comes to us through that app. So as he correctly said, that this is not a job of one surgeon who is putting a balloon, or a gastroenterologist who is putting in a balloon, or anybody putting in a balloon, but it's a job of a multidisciplinary team, which will have group of dietitians, physical therapists, psychologists, which will be in touch with you, because all your information is coming through your watch, synced in with the app made by this company on your smartphone, and then it comes to us. So this is beautiful program, and in the end, I think, Manuel, what I, as Professor Ram Chuttani says, that this is your honeymoon away from hunger. It's your holiday from the hunger. So when you have your holiday from the hunger by this balloon, always remember that anything we do a bariatric surgery on you, or we do this balloon, or we do an endoscopic sleeve, anything we do is just an opportunity to help you inspire good habits and bring that change in your lifestyle. And as most of these studies done in psychology have said, that if you follow something for 60 days, it becomes a part of your lifestyle. So anything we do, including bariatric surgery, is to modify your lifestyle, help you bring a complete lifestyle modification change. So please use this as a tool. Then being completely dependent on these devices is a shortcut to your weight loss. So Manuel, there is a very interesting question, because now we have a cafeteria approach. You have a balloon, you have surgery, and then there is endoscopic sleeve, and then there is post to, and there are several other weight loss procedures. So how do you avoid this confusion? Do we need all of them, or is there a role of surgery, or how do you, basically, what is your algorithm to treat your patient? I mean, everybody, we have a way to take an approach.
Sure.
So what is the role of all these different modalities here?
So Mohit, obesity is a chronic, progressive, and incurable disease. So what you need, and what comes to my mind, I just heard you talking about those different types of procedure, reminds me a word that is portfolio.
Mm-hmm.
So in a chronic disease like that, so for example, diabetes, you have a portfolio of drugs that should be used in any step of the way, like hypertension, the same. And obesity as well, because obesity is even more complex than those ones. And by the way, obesity is the leading causing of diabetes and hypertension.
Very true.
So we have to, as a complex problem, we need to have a portfolio to act on that. So like for this, qualifying that as the disease. So disease is not that aggressive. You are overweight. You're beginning your weight gain process. So behavior modification, medicines, and exercise, because this is the best way to do, is to prevent that to happen.
Yeah.
But once it happens, and unfortunately it happens very often, you need stratification of the treatment in a stepwise manner. So if I can do that in a stepwise manner, I will put the clinical treatment, behavior modification, drugs, diet, and exercise for the beginning of the disease. As the disease progresses and those measures are not enough, so that comes the bariatric endoscopy. And in bariatric endoscopy, we can also stage that as a balloons for less aggressive disease, endoscopic suture for more aggressive. More things are coming, like you told, the post-to, the plication, and things like that. And then if the disease really progresses, or we catch the patient in an advanced stage of the disease, look at my language, advanced stage of the disease. Remind cancer? Because obesity can be read like this evolution. With that, you need a more aggressive treatment. That comes the surgery to control the disease at that time. So this comes in a way that if I don't know if I'm get myself clear, that stratifying the disease, we need all of those tools that you just described. If you understand the nature of disease, if you don't, you're gonna think this one method is enough for everybody, but it's not, and you're gonna get frustrated because it's the lack of empathy. Empathy is put myself on the place of the other. So I have to see my patients. Doesn't matter what I think, it's matter what the patient is feeling and how this disease impact the patient. Empathy is the word on that, and understanding chronic disease, that is very important to have such an armamentarium that we just shared about, and we never downsize the problem. We just wanted to understand more, and this, as we showed to you, is a new thing on the armamentarium that definitely will add to the benefit of the persons who suffer from obesity.
Wow. So as Professor Gelbao very correctly said, that obesity is a recalcitrant disease. It's a disease which is very chronic, just like cancer. Forgive me, I'm comparing obesity with cancer, not because I want to make fear out of it, but the point I'm trying to make here is that just like when you deal with chronic diseases, you need treatment which starts from a very small treatment to something in the mid-range or to something very aggressive. And let me tell you that just like we have a combined approach of radiotherapy, chemotherapy, and surgery in a cancer patient, obesity being such a chronic disease, we require drugs, we require balloons, we require endoscopic sleeves, and then we require surgeries. In language of Professor Galvao, we have to stratify or we have to grade the disease and then treat these patients. So not any one of these are important, but all of them at different stages of the disease are important. So at the end of this session, I would like to thank all our viewers, but I would like to inform you about something very important, is that all the procedures we talk about, whether it's an endoscopic sleeve or it's a balloon or it's a beautiful swallow pill like this or maybe a surgery, these are just a chance given to all of you or to all of us who undergo these procedures to change our lifestyle. This is just like a loan we give, and all of us will have to repay this loan with interest by doing our hard work, changing our lifestyle, and trying to follow good habits. Only then these procedures from a milder version to the very stronger version will be successful. So thank you very much, Manuel, for sharing your time and throwing light on a very important subject. And I hope that I find you in my clinic to discuss more upon this topic. Thank you so much again.